So today's video we're going to discuss fat transfer. Fat transfer is an exciting plastic surgery technique where we take fat from your own body and then we inject it where either there is a contour defect or there is significant volume loss. It is especially useful in cosmetic surgery, but is also a very useful technique in reconstructive surgery and gives a very natural soft contour where the soft tissues are left with an indent. Fat transfer can be a very helpful tool to return the natural contour by using your own biological tissue. Specifically in cosmetic surgery, fat transfer is used to build up either inadequate soft tissue volume or in cases where previous soft tissue volume has been lost. One place where fat transfer has gained significant popularity is in breast reconstruction. Breast reconstruction and breast augmentation can be carried out using fat alone over 2, 3 or 4 different fat injections. They can augment your own breast with your own fat tissue. This is especially of value for people who don't want an implant or for people who have suffered from implant-related disease. From my point of view, fat transfer is an excellent technique for improving contour defects on the body, but more specifically in my practice for improving the soft tissue volume of the face. We often find patients who take up long distance or endurance activity in their 30s, 40s and 50s have very athletic bodies, but they often lose soft tissue and softness from their face. For ladies, this can result in a lack of softness, which isn't specifically feminine. Other indications are where people's soft tissue volume from their cheeks have fallen. This is a very standard thing to happen from the age of 35 all the way up to the age of 70. Our cheek volume is typically soft and pillowy and sitting right in front of our cheekbone. What we find as we get older is there is subtle changes of the skull shape. This means that the bones of the cheeks become shorter and a little bit more acutely angled. This essentially means that the soft tissue volume of the cheek itself can slide forward and down off the cheekbone, leaving an empty cheekbone with some soft tissue sitting below it. This is a classic sign of mid-facial aging. What we often see in the current day and age is people turning to fillers. Fillers are hyaluronic acid and they act very much like a volumizing agent to replace lost volume in the cheeks, in the lips or in other places in the face. Fillers are an excellent option when the volume loss is minor or when a temporary result is required. Unfortunately, as many practitioners and patients know, fillers are not permanent, lasting anywhere between 6 months and 24 months, and so repeat applications are almost always necessary if you want to maintain that look. As an alternative to fillers, fat provides an excellent choice. The key advantages to fat is it's made of your own tissue, and so in pretty much all people there is an unlimited supply of fat that we can harvest. Once the fat is embedded in its new home, then its volumizing effect is permanent. It also adds some very attractive softness and creates a very beautiful contour to the cheeks or the lips. Furthermore, completely opposite to filler, fat is permanent. The permanence of fat does bring one slight disadvantage. In my specific practice, I tend not to recommend fat transfer to either face or lips in patients under the age of 35. There is a key consideration, namely that fat harvested, for example, from the abdomen, never forgets that it's abdominal fat. If we then inject it into the face or lips, that fat, still thinking it's abdominal fat, will increase or decrease in volume as your abdomen increases and decreases it in volume. Specifically for patients who gain weight during pregnancy or gain weight later in life, the volume on their cheeks can also gain weight exactly in line with the abdomen. This can make undesirable appearance, and once in place, it's actually very difficult to remove excess fat from the areas where we have injected. The process of fat transfer is, in the vast majority of cases, done under local anaesthetic in an outpatient setting. Having said this, it can be combined with other operations, for example, facelift surgery. Your consultation will discuss where we believe you are deficient in volume. For the vast majority of patients, this is the cheek area or the lips. To a lesser extent, fat can be helpful to soften nasolabial lines and marionette lines. But overall, fat is best preserved for areas where volume is lost. Nasolabial lines and marionette lines are less suitable for fat transfer, in my opinion. Your consultation will discuss what you've tried before. Patients have often tried fillers and often extensively. This is not specifically a problem, but my advice is always to have the fillers dissolved shortly before fat transfer to create a clean sheet in terms of the anatomy, and also to give us an idea of exactly how much fat volume will be required. Other things to consider are your job and your physical activities. Extreme physical exercise is not recommended shortly after fat transfer. Patients who smoke are typically poor candidates for fat transfer, as smoking is highly likely to result in failure of the fat to survive. This not only is disappointing, but can create specific problems which we'll discuss. Do you plan any additional cosmetic surgery? Fat transfer is often an augmentation to procedures like mid-facelift or facelift, but in not many cases is it an alternative. The aging face is a product of both loss of volume, but also descent of certain tissues like the cheeks or the neck. Volumization with fat will not correct all of the signs of facial aging there. Other things to consider are any medications that you take, including blood thinners or pressure medication. Either of these may lead to increased bruising where we take the fat from and where we inject it, which may inhibit the ability of the fat to survive. We will take photos, and we will also send you a copy of this video, but also a consent form to read in detail. You can certainly drive yourself. After injecting where we are to harvest the fat, usually around the belly button, this is a painless procedure, although it feels a little bit like you're being poked with a finger. In most cases, 5 to 10 cc of fat can be harvested without much difficulty. The fat can be separated in any number of ways. What I tend to do is separate the fat from the local anesthetic and tissue fluid using gravity. Once the undesirable elements of the fat have been separated, we then have a sample of pure fat mixed with local anesthetic to re-inject. If we're injecting the fat into the face, then an excellent way to make the area numb is using something called a dental block. This is injected into the gum and makes the entire mid-face numb on both sides, allowing fat transfer without any discomfort whatsoever. Using a 1 cc syringe and a specialist blunt needle, the fat can be injected anywhere it's needed. The blunt cannula technique minimizes any trauma and also minimizes the likelihood of fat passing into the blood vessel. In terms of post-operative recovery, we put a small stitch in the abdomen where the fat was harvested. The face doesn't need any stitching, but will look a little swollen and occasionally bruised. Thankfully, bruising is rarer than you would find with filler and Botox. You go home within an hour. Our advice is that you refrain from excessive physical activity, but you can certainly work at a computer, and probably the next day, accepting there will be a little bit of swelling, you could probably go to work in an office. If you have small children, then you will be able to look after them immediately following your treatment. We find 24 to 48 hours after fat transfer, the swelling starts to go down and the face starts to look a little flat again. This is a result of a little bit of the fat being absorbed, which is natural, and also a little bit of the fluid injected with the fat also being absorbed. There may be some bruising or swelling around the abdomen and a little bit of discomfort. Key things around fat transfer are the uptake of the fat. It is very difficult to predict exactly how much fat uptake you will experience. There are a number of factors which can affect this. Thin faces tend to not allow fat to adhere as well as slightly fuller faces. This is a difficulty of fat transfer. I often liken fat transfer to throwing cooked spaghetti at a wall. If you throw a few strands, it will likely stick. The entire pan will likely roll off. Fat transfer in thin-faced people is augmented by subsequent treatments. and this will be discussed at your clinic visit. Some of the fat that we inject will definitely not survive. Survival rates can be anywhere between 25% and 80%, and unfortunately they are a little unpredictable. We will inject what we think will be a little bit more than you need, accepting that some will be reabsorbed. Having too much survive will give you overly filled cheeks, which are hard to treat secondarily. Your final result from fat transfer will take between 3 and 6 weeks to emerge. By this time, the fat cells that will die will have been reabsorbed, and the fat cells that survive will have stabilized in their new home. Infection is rare, but is a consideration of fat transfer. It can arise from dying or dead fat cells that can carry bacteria before they are reabsorbed. If you experience hotness or redness or specific pain following a fat transfer technique, then let us know as quickly as possible and we will give you antibiotics. Thankfully, infections following fat transfer are rare. We often see patients who have had fillers to their cheeks, for example, or tear troughs, or to their lips 5, 6, 7 or 8 times. The process of repeated injections of filler with a large needle into these delicate areas leaves behind scar tissue. This scar tissue creates a volume and stiffness of its own and is often the reason why celebrities or people who we know in the public eye having quite stiff and wooden faces. This is excess scar tissue from multiple injections of filler to these delicate areas. Once the scar tissue is developed, then the volume from the scar tissue will persist long after the filler effect has gone. This can be unfortunate when talking about lips, as this can leave very lumpy and uneven lips, which cannot easily be treated and cannot easily be softened either with or without fat. Another key advantage of fat is living fat cells have a stem cell effect. This can rejuvenate damaged skin and can also bring some freshness and softness to previous scar tissue. This really is a key advantage that is unique to fat transfer. If you believe that you have volume loss somewhere on your face or a soft tissue defect on your body that would benefit from filler, but you're concerned about the effects of filler or the cost if the defect is of significant volume, then I definitely think fat transfer is something you might wish to consider. By all means, get in touch with us here at adamgoodwinsurgery.com. We would happily offer you a free consultation to discuss fat transfer as a technique for you. In my personal opinion, it is so simple to do over a half an hour outpatient visit that it is a genuine alternative to filler, both from a cost perspective, a time perspective, and when successful, it is vastly superior both in softness, shape, and permanency. Contact details are available at the end of the video if you would like to get in touch with us here to discuss fat transfer treatment.